here with my mom, Jennifer Bradshaw, and I'm going to ask her a few questions about her career. How did you get into the field of imaging or healthcare in general, and why did you choose it?
Well, I originally thought I wanted to be a nurse, and the reason I chose that is because I wanted a career where I could help people, and really one that I would be active during the day in. I can never imagine myself sitting at a desk. So I first started out as a CNA, and I worked at a hospital while I was going to college, working on my nursing degree. And I think it's in that experience that I realized I knew I wanted to work in patient care, but that I didn't necessarily want to work with patients and their families for 8 to 10, 12 hours a day. So I started looking at other areas in the hospital where I could still be involved with patients and be involved in their care, but not such long periods of time. And that's where I came upon imaging.
My next question for you, Mom, is what was your motivation to change from X-ray imaging to breast imaging, and how long have you been in this field?
Well, when I started out, I was an X-ray tech. That's a common starting point for most imagers, and I worked in general X-ray. But then, as a woman in this field, it's a great skill set to have to go on and get your advanced degree in breast imaging. It just helps you be more marketable and give you more options when you're looking for jobs. So I right away got that advanced certification. And early on, I started doing both X-ray and breast imaging. I kind of had a shared role in my job. And then about the last 13 years or so, I've been dedicated to breast imaging alone. So all in all, I've been a technologist about 23 years.
Next, Mom, I just want to ask you what exactly it is that you do within your job.
Well, I do work in a dedicated breast center, so all imaging and all of my job serves around taking care of a woman and her breast health. So this can be anywhere from performing screening mammograms on women as they come in for that annual preventative screening exam. So I would do a fair amount of those. But because I work in a comprehensive breast center, we work with a lot of breast cancer patients. So I am meeting women when they're coming in because they have a problem. You know, problems can be anywhere from they're having a lump, or they've noticed a change in their breast, or their doctor's found an area of concern. And so they will come to the breast center, and I'm the first person they meet before the doctor. So I'll take a health assessment on them. I may perform a breast exam. I'll do some dedicated imaging with a 3D mammogram machine to evaluate the area of concern. And then I'll have the patient wait. I will do a fair amount of charting, so there's lots to enter into their medical record. And then I'll present the case to the breast radiologist. I work with dedicated breast radiologists in the breast center. These are highly trained doctors that are specifically skilled in detecting breast cancers. I'll present the patient's history and their symptoms to the doctor. We'll review the images together. They may ask me to go do some more imaging on the patient. They may need me to get some more history on them. And then I'll do a handoff, oftentimes over to ultrasound for those patients. There's another big part of my job that I do in working with those patients once they have been diagnosed with breast cancer. So oftentimes in that diagnosis process, we'll need to do a biopsy to get that definitive diagnosis. And so I assist the radiologist in the procedure. I run the equipment that helps us sample the tissue. I image the tissue during that sampling process and prepare it for pathology. And then I take care of the patient after their procedure. I'm doing their dressing change. I'm giving their instructions for their post-care at home, and teaching them how to take care of their surgical site once they get home. Some patients we're preparing them on the day of surgery for when they have their lumpectomy. So we do something called a mammographic wire localization, where we'll actually guide a wire into the breast, right directly to the area of the cancer. The wire will then just be anchored in their tissue, and they'll be bandaged up and they'll go to surgery. And that, in a sense, creates a roadmap for the surgeon to know what to remove when they are in surgery.
That's awesome, Mom. Saving lives. Next question. My next question for you, Mom, is what is one positive aspect of your job and one negative aspect of your job? And how do these things affect you?
Well, I would say a positive aspect would be that I get to help a lot of women in what I do. Whether it be, walking a patient through their first baseline screening mammogram and they come in scared and I can ease their fears and do their exam and show them that they can do this. Or whether it is walking through a breast cancer diagnosis with a patient, getting to know them from those initial appointments of when they're coming in with symptoms to the day of seeing them on their lumpectomy, where they're finally getting some resolution to that long diagnosis process. And then the best part is getting that follow-up care year after year when they come in and I can see that they're doing okay and that we can, reflect back on the battle that they fought and that they're doing well and that they can bring hope to other women.
That's awesome.
And a negative aspect of my job, it can be physically exhausting. I do work long days. I work 10-hour shifts. I do not sit down at all during my workday. So I am on my feet all day long. So I'm tired by the end of the day. And as I'm getting older, it becomes more, yes, I'm exhausted at the end of the day. So it's hard to go home and then have the energy to do what I need to do in the rest of my evening.
Perfect. Thank you. Okay, Mom. My next question for you is, have you noticed any advantages or disadvantages to working in a hospital department primarily for women patients?
I would say that I think there's a lot of advantages working in a department for women. First of all, I'm a woman, so I understand the emotions that a lot of women bring into the department when they're there. And I can meet them where they are because I understand what it is to be a woman and to be in that position. But I also feel like our department is very well supported by our hospital because it has statistically been shown that departments like the breast center or labor and delivery are important gateway departments to hospital and to healthcare because women tend to make the healthcare decisions for our family. So our hospital really has the focus on making that a positive experience for women, because if a woman leaves our department feeling like she's been well taken care of, like she's receiving the best possible care she can, then she'll want to then bring her husband to that hospital for care or bring her mother or children. So the hospital has really focused on making our department cutting edge, top notch. They put a lot of special touches into it, and there's a lot of funding that goes towards our department to make that the best experience that we can for our patients.
Okay, Mom, for your last question, I was going to do a reflection question. I want to know how you think your younger self would feel about where you are in your career today. Would she be proud of you, surprised?
That's a great question, Taylor. I think partly a little bit of both. I don't know that when I went into imaging right out of school, I would have thought or pictured myself working solely in breast imaging. But I think proud as well, because I have got to affect so many women and help so many women in my field by what I do each day, that I think there is a bit of pride that would be in that as well. And And mainly, I see myself fulfilling what I always knew I wanted to do, and that is work in patient care and to serve patients and be able to take care of them when they're, in the most vulnerable times and scary times of their life.
Thank you, Mom.
You're welcome.
I'm so proud of you and your career.